Hello and welcome to webinar series. Myself Shanti, and today's topic is all about on the respiratory health in winter. As we all are embracing winter season and its unique challenges to respiratory health with cold and dry air and frequent respiratory tract infections. So, joining us for this discussion, I may now welcome our expertise, none other, Dr. Pranay Saigaru, who is our Senior Consultant Interventional Pulmonologist from Yashoda Hospital, Malakpet Unit. I welcome you, Dr. Pranay.
Good afternoon. I am delighted to join.
Yes, so do we are privileged and honored to have you with us today. And I now request all the speakers to introduce yourself. Yes, Chinni.
Yeah, good afternoon, one and all. Myself, Chinni. I'm currently working as a nursing college principal at Dave's College. Currently, I'm from the Kushaiguda.
Yes, thank you to accept this invite, Chinni. Yes, so now, Glory, are you there?
Yes, ma'am. Yeah, thank you. So good afternoon, everyone. So my name is Glory, and I work as an L&D trainer at Atulya Senior Care. I truly feel happy and honored to be associated with Yashoda Hospital once again. Thank you,
Yeah.
ma'am.
Thank you, Glory. And can you just turn on your camera, Glory? Glory, we can't see you.
Yes, ma'am.
Yes. Okay, we are going to keep this session very time bound as by core fundamental. Anything we learn, we always should learn with the numbers or few statistics or little about prevalence about it. So now my first insight we I like to understand from Dr. Pranay. Now we are experiencing winter, and so do the challenges and pulmonary health. It is affecting the respiratory health as well. When I was just going through uh, about this site, I could just quote from the CDC guideline, and thereby we understood that seasonal influenza activity is very elevated. And what are the few common respiratory challenges you are observing since you are the treating physician in this season? And yes, we like to understand from you. Over to you.
So, as you have already stated the advisory from the CDC, so it
Yes.
has already shown there is a spike in respiratory tract infections, which usually spikes up in winter. So, apart from this update in 2026, there was a update in similar update from the WHO regarding the spike in respiratory viral infections, which was given in January 2025 in a similar way. So I just wanted to tell you that this is not particularly to a single winter or a single season. So
Yes.
generally, winters every time brings a lot of new variants of viruses which thrive for a longer time, and as long as they thrive outside the human body in an inanimate object, they are prone for repeated and recurrent infections in humans, the hosts. So we face a lot of challenges in terms of these respiratory tract infection, as they are not the only infection which is going to worsen the patient's condition. They are
Yes.
going to exacerbate the underlying condition, like a patient with asthma, a patient with COPD, a patient is too frail to perform his daily activities with this
Yes.
kind of illness suffers more.
Yes.
So, apart from being an infection, it acts as a spark to ignite a bigger flame.
Yes.
So, this we encounter every winter, but with certain precautions, we can very well manage most of the patients. Uh, they will not go up into like a very severe flare. So we can control these as they are seasonal and they are definitely encountered every time. So we are able to handle them. So
Yes.
respiratory challenges is just to keep maintain hygiene is a problem because there is lot of loss of humidity in the air, and the air becomes more chillier, so that even cold air can sometimes irritate your bronchial mucosa.
Yes.
So
Yes.
that is going to cause again more mucus secretion, more nasal secretions and everything.
Yes. Yes. Yeah, so we very productive, informations you have provided, and we will also learn, hear from other speakers what they are interested to learn about. Yes, over to you, Chinni. Yes,
Yeah, sir, we just wanted to know that which any specific bacteria or viral infections that's really which affects, especially in the winter season, sir, like any special bacteria or viruses which really affects on the lung.
So the viral infections and bacterial infections usually are more prone in winters because
prone in winter.
see, uh, when the virus or bacteria is inside our body, it keeps replicating. But once it reaches outside in an inanimate surface with right temperatures, it cannot survive. But in colder seasons, colder climates, or colder areas, when it reaches an inanimate object, it tends to survive for more time. So, without proper hand hygiene or contact prevention, these viruses from the inanimate surface can be transferred into your body and in turn will lead into infections. It is not more about the bacterial survivability inside our body. It is the increased survival chance outside our body, which makes many number of people prone to such infections.
So that's how we consider this as a droplet infection more, and the surface is again your hand, the source
Yeah.
of infection. Yes,
So basically, the surface infection without a proper hand hygiene will spread more fast. So
yes,
this happens more often in winters.
yes. So yes, and now over to you, Glory. Yes, do you wish to understand from yes our expertise? Yeah.
Yes, ma'am. So yes, sir. So like as you have said that the winter season is more prone for the existing conditions, and the people may develop new infections. So since I work in a senior care, so I wanted to know more about how can we prevent the such cases in our clients, because most of the clients are either they are with COPD or asthma, that kind of respiratory condition, or sometimes no they develop because of the climate. So what can be done to prevent those conditions in our clients?
So the thing is that most of the patients with respiratory illnesses, the chronic
Yes.
respiratory illnesses, what we see, like asthma or COPD or bronchiectasis. So whenever it is winter, so we ask them to maintain proper measures to warm themselves up,
Yes.
to take more humid air inside by even placing a mask in front of your nose so that there will be some barrier which prevents that loss of humidity from your own body. And in turn, this humidity, which is a pocket of air within your mask, will create uh, the air going in the right temperature and right humidity. So such kind of small measures can help a lot of patients. Apart from that, taking proper diet and supplementing your patients with good vitamins and especially vitamin D. So
Yes.
in winters, people generally don't move out due to chilly weather and everything. They get a lot of less vitamin D. So vitamin D is a very prominent role in allergies, prevention of allergies and building up your immunity. So supplement your patients, or I usually supplement my asthma or COPD patients with vitamin D for at least 2 months so that their baseline levels are filled and the rest of the supplements come from their dietary products in daily diet. So these
Yes.
things you can do. The other thing is keeping themselves warm in a cozy environment with the humidity should not be too high or too low. So they have to
Yes.
maintain a constant level of humidity so that they are comfortable. So
Yes.
prevention of contact prevention is one thing what you can follow with regular hand hygiene. Droplet prevention is anyway taken care by the mask.
Yes.
So these
Yes.
are the measures which I advise my patients to avoid flares.
Yes. So, by default, during this winter season, and as a Glory rightly said, elderly patients, you always prescribe them with vitamin D so that they
Yes.
are safe. Yes. Yeah. This is again new learning point. Yes. Jenny, over to you.
Yeah, sir. And generally, can you just tell me that who is the highly risk? Like recently, we have seen that immunocompromised, such kind of patients we have seen in the hospitals and in the college also. Also in public sectors and colleges also, a lot of the people regularly they have to say that we are suffering with a cold common. Commonly, we consider as a in winter season, cold is very common. So may I know the who really risk
See,
getting
apart
from
from
this?
this, yeah, apart from the strata, what you have mentioned is the strata of people who are already known immunocompromised and chronic, suffering with chronic illnesses. This can be respiratory illnesses, this can be cardiac illness or renal illness. So these patients are more prone for any infection. Apart from that, I come across a lot of patients who have suffered with a recent sore throat or recent rhinitis or sinusitis episode, coming back telling that they are having even more symptoms now. So this might be due to a brief drop in immunity due to the viral infection which they have received. So viral infections are prone to cause some sort of leukopenia, so in which your white blood cell count goes down and
Goes down,
momentarily
yes.
the time it takes to build this immunity back again will be a brief point where you can get other bacterial infections. So even this period, we are considering a risk factor immediately post viral illnesses.
Yes.
So recovery from a viral illness will happen eventually with your immunity, but only that kind of immunity will protect you from a virus. So at this point of time, if they are attacked with a bacteria or a fungi, then that immunity will not suffice. So at this point of time also they are more prone. So post viral illnesses, as you have told you, immunocompromised states, chronic illnesses, which is respiratory, cardiac, renal, are more prone for infections.
And also, I think those who are working with outer environmental exposures like cotton dust and your sugar cane,
Yeah,
engineers at the site, roadside workers, they also might be feeling facing these challenges of allergens, which triggers their respiratory tract, and they seek your help.
the occupational or environmental exposures have been long there as risk factors for any kind of illness, not
And
only
yes,
respiratory tract.
yes,
Nowadays, they are causing more psychological symptoms too. And when it comes to the direct organ which is threatened, it becomes either your upper respiratory tract, your eyes, your nasal mucosa, and your lungs.
yes.
They are directly exposed. And even some times the GI tract if the exposure is very high.
And I think these conditions are being more faced by school children and the college young teens, because I think the numbers in the college and schools are very high. There is no distance measures are taken. They don't wear the PPE, and so do the hand hygiene. I think these are the very common factors.
PPE is very far from use, but they are not
Yes,
even wearing masks.
yes,
So the
yes,
quantity of pollutants in an environment which we measure by AQIs is not same in all the areas. It might be different. It might be high, it
yes,
might be low. But in
yes,
all metropolitan cities, I assume that AQI in a specific time point varies largely when there is lot of crowd outside, lot of vehicular activity outside, lot of
yes,
construction activity outside. So such kind of exposures are non-quantifiable.
yes.
So taking precautions is the only thing what we can do. We cannot avoid all kinds of exposures.
Yes. So, Doctor, again, I would like to ask you one, the doubt. Like we see common students, like whenever they are by the bedside or they are, handling the patients or fomites or blood or, anything. But for bedside, whenever they come to the conference for the class and all, I see them, wearing their mask and they sit in the classroom for the quite long, whether it is a 2 hours. And a few individuals or few, population, they just right from the morning till evening they wear the mask. Is it the right practice? Because we have heard about CO2 retention or taking the same CO2 inhalation in. So this is whether it is a myth or fact. You would like
Basically,
to just.
it's a very long looked into story. So actually, this mask, what we are placing in our oropharyngeal and nasal mucosa in front of these
Yes.
things, the barriers. So this mask is allowing the air to pass from the sides. So it is only going to prevent the head-on um, air or in what aerosol which is being generated by different activities. So
Yes.
it is not going to cause that much CO2 retention.
Yes.
So unless until it is airtight, there
Yes.
can be some CO2 retention. And
Yes.
generally, young population without any known respiratory illnesses, they usually will not get any kind of effects with this kind of CO2 retention, which might be minor or so. But in
Yes.
patients with COPD or who are already having high CO2 levels in their blood, like patients with obstructive sleep apneas, with obesity hypoventilation syndromes, so there can be minor changes in their blood gases, which can, on a chronic duration, can lead to some metabolic abnormality. Rather than that, young
We
patients
can.
without any known respiratory illnesses, I don't think so it is
Yes.
going to affect them a lot. But I warn, because keeping your mask too long might make it humid, so that there can be secondary bacterial lodgement or fungi spores. The fungal spore lodging
Yes.
into those areas will be high. So in order to prevent that, you can either take out the mask, dry it for some time and put it back again, or
Yes.
you entirely discard the mask when it becomes wet and wear a new one.
Yes. Very thankful, insight you have provided, because this was my own doubt and I wanted to clear it up. Yes. Yes, Chinni. You wanted to ask a few overlap, asthmatic and COPD clients precautions. Yes. Over to you.
So, thank you so much, sir. It's a very valuable information, actually. And can you just suggest me that, sir, any specific things in winter, like so most of the people now they have to say that only because of the diet or their personal hygiene, everything you have discussed, sir. Apart from that, we can take any precautions on that, sir.
I personally ask or request all my COPD or asthma patients or any patients with chronic respiratory infections to maintain proper oronasal hygiene. So the oronasal hygiene, which uh, gets a lot into your flares. So when it is a very poor hygiene, then you'll get into more number of flares.
Yes.
So keeping your nasal mucosa free of infection and oropharyngeal mucosa clean as a part of routine oral care, what we do, the brushing or
Yes.
the gargling, what we do, you extend it with a labeled bactericidal agent. I personally prescribe betadine. So betadine or whatever the chlorhexidine
Chlorhexidine
mouth,
or yes.
the chlorhexidine mouthwashes. So they are good in preventing the superficial contamination, and they will clear a lot of bacterial load, so that less bacteria will be there and our immunity can take care of the bacteria. So such kind of things are essential. So oropharyngeal care and nasopharyngeal care, they are most neglected parts in our daily life. If they are
Yes.
taken care good, so most of them will not even get their upper respiratory tract infection. Thereby, we can prevent flares.
Yes. So yeah, I think only few slides we are away for ending this session. Yes, Glory, over to you for your learning. Yes.
Yes, thank you, ma'am. So, as you're talking about these respiratory conditions and also, is the flu vaccine, will it be like to what extent it will be useful for the patients? Like, as I work in, like, as I already said, like, I work in a senior care. So, is it advisable for the older age people to get the vaccine? So, to what extent it is going to be effective?
Yes,
Yeah,
sir. Whether it
actually,
is going to give a lifetime protection, because in India, the behavior and mindset of people, they don't opt out for, this
yeah,
vaccine. Though they continue to suffer because the modality of treatments and technologies are good, severity of, diseases are lesser nowadays because of your clinical able expertise, thing. So, what is your take on the same? Even everybody wish to understand.
yeah.
Yes.
See, most of you might be knowing influenza vaccination, but
Yes.
many of you might not be knowing the pneumococcal vaccination along with. the Tdap, that is the pertussis vaccination,
Tdap, yes.
along with the vaccination for shingles, that is zoster,
Yes.
varicella zoster. So generally in chronic respiratory infections, people are prone for all these kind of viruses and bacteria. So we generally prescribe to take all these vaccines according to their schedules. So here now with the PCV20 vaccine in our hands, it is good for pneumococcal disease. So it will prevent severe pneumococcal disease, which is taking a lot of lives if at all not treated. So this is a single shot vaccine. So once in a lifetime, a single dose in adulthood will protect you for your entire life. This is pneumococcal. So we generally prescribe it whenever you come to our OPD with a chronic respiratory condition or any patients who is above 60, even with small comorbidities like everyday comorbidities like hypertension, COPD, should be taking these vaccines. Any patient above 60 years with risk factors, without risk factors, it is advisable to take this vaccine along with the annual shots of influenza vaccine. So, because influenza uh, changes its shades very every year, so the neuraminidase and the hemagglutinin spikes on the surface of the influenza virus, they mutate every year and they tend to evade your immune responses. So in order to prevent this, every year annual influenza vaccine is recommended. And because it takes time for vaccine development, generally the vaccine development happens around July to August or June to
Yes.
August time. And post August, we will be given a new strain, a vaccine for a new strain. So
Yes.
generally post August session, the new vaccine will be available every year. I suggest this is the right period where you can take this vaccination. So every year, influenza vaccine should be taken, and pneumococcal vaccine, which is PCV20, is a lifetime single dose vaccine. And the other vaccines which I've been talking about is more for patients with chronic respiratory condition. Shingles vaccine is a two-dose vaccine,
Yes.
and Tdap is again a booster dose. Generally, Tdap will
Yes.
be given in our childhood, and whatever
Yes.
we take now will be a booster.
Yes. So this PCV20 can be taken even though, as a prophylaxis part, you meant to say, sir?
Yeah, actually,
Yes.
it's vaccination. There is nothing prophylaxis about vaccination. It is
Yes.
going to
Yes.
prevent severe infections, which
Yes.
might land you into a hospital for a routine respiratory tract infection, but will save you from an hospital admission or ICU admission.
Yeah. Yes. Yeah. We have almost come to the end of this session. Yes, Chinni, few contraindications of food you wish to ask?
Sir, sir, can you please suggest any better thing like diet? Also, you said it's a very, very important, sir. What kind of food
Yeah.
items you would refer if according to the patient,
What can be
according to the
avoided
condition?
during this season? Yes.
See, cold and um, often refrigerated foods.
Yes.
So even though they are prepared at home and refrigerated for some time, like you prepare it in the morning or you tend to eat it in the afternoon or the night. So generally these kind of foods can be cold and can trigger some issues with your oropharyngeal mucosa and gut also. So I advise all of my patients, whatever they prepare, the balanced diet which we are going to take should include proteins, carbohydrates, and essential fats. So these kind of things, when they are combined with freshly made foods, like this, eat it when it is warm.
Yes.
So this will prevent a lot of diseases, lot of
Yes.
flares, even with food related contaminations or anything. So eat it when it is warm, and don't try to refrigerate all the foods except the ones which you want to preserve for a longer time or you want to re-prepare. Those kind of foods should only be refrigerated. And I also advise to limit your alcohol intake to the level which you will be conscious and
Yes.
you will not be prone to any aspirations in your sleep or during
Yes.
your unattended times.
Yes. So yes, and we request all the viewers and everybody, as we understand in India, we always see a lot of Indians, they keep taking OTC medications and they keep medicating themselves. We ourselves sometimes when we have little rhinitis or cold, we just one very great product which we use is azithral. 500 mg for into 3 days, and then vice versa with Monte Kelsey and so do. So, what is your, few important, very short point on OTC and self-medication, which can be very harmful if at all it is not, under the guidance of doctor and prescriptions based. Yes.
Um, See, the antibiotic prescription over the counter is definitely going to harm the patient.
Yes.
The only thing which you can take over the counter to combat your symptoms is a paracetamol.
Yes.
The only thing what I suggest any of my relatives or my patients, if at
Yes.
all they are suffering with some kind of fever or anything, in order to just get him some time to get into medical care,
Yes.
I suggest him to take that medicine. So other than that, see, everything what you get over the counter has one or the other side effects. So if the effect is not suited for you, it will become a side effect. So apart from this kind of side effects, you will have real side effects, which will impair your organ function or
Yes.
will decrease your daily activity, especially with the over-the-counter cough syrups. So sometimes people are even going a bit far, even procuring codeine or narcodeine like
Yes.
preparations over the counter. So
Yes.
these are going to relieve your symptoms momentarily,
Yes.
but they are
And
not
and they
going
are
to,
addicted also to this
uh,
codeine and all. Yes.
they make yourself addictive to that substance and they might only make you to keep on taking them.
Yes.
And the
Many.
second thing is
Yes.
antibiotic resistance. So
Yes.
you might take it if at all you don't have any bacterial infections, you are going to take azithromycin. It remains in your body to certain extent so that it won't be fit enough to fight any infection, nor it can be completely excreted out from your
Yes.
body.
Yes.
So this kind of concentration becomes a very favorable ground for any bacteria to develop resistance. So the next time it won't work.
Yes.
Or
Yes.
you have to load yourself with other kind of antibiotics in a higher dose.
Yeah.
So I only suggest all of my patients or whoever is watching this to come to your physician,
Yes.
whoever it might be. He might not be a specialist, might not be a super specialist. But with the right set of symptoms, every doctor can provide you whether you require antibiotic or not. So when you require it, there is no stopping. But when you don't require it, you should not take it. It is for
Yes.
your own good health.
Yes. Very productive take-home insight and message you have provided. Yes. And now, Glory or Chini, do you also have any learning points to be asked, and then we end the session?
Sir, if you don't mind, is there any new treatments or new therapies we have available in this um, um, respiratory system? Sir, like I've seen that one of recently they said it's like we have a therapies in the respiratory, and any innovations we have, sir, regarding the treatment?
See, for chronic respiratory illnesses, we have many. But when it comes to only upper respiratory tract viral infections, we have barely made any new progress. So the last antiviral which I uh, use frequently is oseltamivir, which works for influenza.
Yes. Yes.
So apart from that antiviral, which is prone to be efficient in treating influenza infection, there is no specific antiviral for any other organism. So most of the viral infections are to be treated with supportive care. Supportive care in the sense to prevent secondary bacterial infections, to support your body, nutrition, and any other deficiencies which you might be having during that period of time will be covered so that your body will recuperate on its own and will fight the infection. So there is no much progress in antiviral treatment when it comes to URTIs. But in chronic respiratory conditions like bronchiectasis, COPDs, and asthmas, we have an armamentarium of drugs, right from inhaled medication to injectable medication. So now we have even progressed to an extent where for severe asthma, we can give a once in 6 months treatment. That is a single subcutaneous injection, which can be given once in 6 months so that your asthma is under control. It will not go into flare or it will not lead into any respiratory failure. So we are advancing in other chronic illnesses aspect, but when it comes to viral organisms, we don't have much progress, or we don't see what kind of specific viruses we are going to get in a single season. It is a mix variant. So in a mixture, it is always difficult to find a proper cure.
Yes. So yeah, that was very valuable insight you have provided. Thank you for your very valuable time. I thank to all the speakers as well. As a respiratory system and its a broader division is very, very, very high. And within this time-bound session, we are great that we have learned a few insight from your end. I thank you for your valuable time and thanks to all the speakers. So we end the session.
Thank you.
Thank you, sir. Thank you, madam.
Thank you.